So joining us this morning is the Burnet Institute's sweep program, Dr. Aung. He joins us on the line from Daru. With that I say, good morning, Dr. Aung, and welcome to Pacific Beat.
Hi, good morning. Thank you for having me.
Absolutely. Doctor, can you just firstly maybe tell us what has been the impact of TB on PNG?
Well, the impact of TB and the PNG is quite huge, especially in the Western province where I work in Daru, which, as you said earlier, there is an immediate TB outbreak in the past that has led to all these challenges, and then now it's ended up with our community screening, which is called Sweep TB in the last 2 years.
But before this project, though, Doctor, what were you seeing in terms of numbers? Like how many people were actually affected by TB?
The number of patients affected every year is quite significant. Let's say like 600 to 700 every year in that area. But it's not only about a number; it's about like a magnitude impact or the population here. So it is quite big compared to the other national prevalence as well as other countries.
Doctor, you talk about the program that you're part of, which is the Sweep TB. What exactly is that, and how has this project, I suppose, been any different from maybe other approaches?
Okay, so Sweep TB is actually, we want to screen, treat and prevent the whole population in Daru Islands. So we want to integrate this TB care into the community, find the cases as early as they can before they are getting sick to come to the health center for the further care. So we also want to build a local community capacity building, health workforce, diagnosis system, referral linkage. So that is the main aims of the Sweep TB. And that is actually not quite very different than other settings. That is what WHO has recommended for community screening for the high burden setting. So that's what we have implemented in Daru Islands.
Can you take us through how that testing looks like when you are screening your clients there?
Okay, so we try to reach every single people on the island. So that is why we use like community engagement, and we use house-to-house screening, and we also utilize X-rays and also like a rapid diagnosis test. So on a normal day, like we started with community engagement with our team and also community leaders and the members, and then we distribute the message, and the team goes house to house, door to door, and we do the symptom-based screening in the house, give it some educations, and then they are referred to a sort of central location close to their houses for the further checkup, like X-ray examination, and also if they are symptomatic or they have some they are presumptive, we collect a sputum, and then after that the result come back either they are at TB or not. So this is a process that we normally do in a normal day.
Doctor, so it's very much a community approach. I can see you're going door to door. What has been the response then from the community? Because, sometimes maybe stigma plays a big factor into people coming forward, right? Is that the case sometimes?
Well, I think people have different ideas, and then they have their own concept in that things. So we also have an experience with community engagement. So we understand what people will think of. So that's why we strategize our community engagement messages, that TB is the thing that we are coming to help them. We're coming to help to screen. If they have heavy disease, we can treat them and we can prevent them. So that is what we also strategize ourselves, our community engagement strategy, to reach to the people, to reduce the stigma, to make them aware, to understand the disease.
Nice. Now, with those who have been diagnosed with TB, I understand some actually had no symptoms at all. So I'm wondering, how critical is this in terms of stopping transmission?
Well, I think this is the biggest thing that we found out. So, we have like more than half of the total active cases that we found are are not showing any symptoms. This is quite significant because it is if we rely on the people who are sick and who came to the health facilities for the care, that will be too late, and that will be like they will be transmitted the disease in the community. So this is the main point that we have to we found out, and then we have helped them discover those hidden cases to get the treatment as early as possible.
Doctor, for those who are listening in, I'm sure they would like to know, though, what are the symptoms that families should actually look for when should they actually seek testing?
The non-usual TB symptoms are like cough, fever, night sweat, weight loss, and they are having like hemoptysis, sort of like a coughing after blood. So that is a usual TB symptom we used to rely on, and that's why we also utilize it. But at the same time, like as I said earlier, more than half of the people that we have diagnosed do not report any of these symptoms. We only discover through the chest X-rays. So it is not only that we have to rely on the symptoms are developing at the stage, which is already maybe late. So whenever there is a contact of TB, whenever there is someone in your household with the TB, we have to diagnose, we have to screen for the whole household. So something like that. So of course symptoms are there, but we should not wait for the symptom until very late, and we have to have like a sort of like community-wide screening to know the prevalence since earlier.
And how has the approach been? Like, what are the results that you've been seeing so far?
So we know that initially it was quite a murmur text that we know that, but we understand at the end that it is possible and feasible to do the community screening in such kind of resource limited setting like in Daru, and we have achieved a high uptake of screening, and then we have found like hundreds of TB cases during the screening. So at the end, like this is a significant achievement, and this is something that we prove that it's possible to do in such kind of community in Daru, as like in Daru.
Nice to hear. Okay, well, Doctor, really, could this community-wide approach that you're doing with the Sweet TB become maybe a model for the rest of the Pacific?
We are trying to do these things in this community because the TB is high and it's a challenge. And then we also knew that this is feasible and possible to do it in such kind of community. So that could be a model that we can further spread, not only in PNG and Daru Western Province, but also other settings which is applicable to. At the same time, like we can also understand the context in the different locations and then modify a bit to expand this activity to other places. We also require like continued investment for the further screening.
Beautiful. Well, some great work that you are doing there, Doctor, and really appreciate that you've been able to come on the show and share about the Sweet TB. Again, we just want to say thank you for coming on the show.
Thank you so much for having a chance to speak about that, and thank you.
Appreciate it. That is Burnet Institute Tuberculosis Specialist, Dr. Aung here on Pacific Beat.